Module 3.4 in your textbook is about carbohydrate storage and disorders. I want to focus primarily on blood sugars. So we're going to look at regulation of blood sugars, hypoglycemia, diabetes, and the glycemic index. How does the body regulate blood sugar? Blood sugars are regulated by hormones that are produced in what are called beta islet cells of the pancreas. These hormones act specifically on liver and muscle cells. And the two hormones involved in blood sugar regulation are insulin, which decreases blood sugar levels, and glucagon, which increases blood sugar levels. If we look at this lovely cartoon, we can talk about, or hopefully understand, a little bit more about blood glucose regulation. On the left, we're looking at the digestive tract. These trucks represent the glucose that is being transported from the small intestinal cells into the bloodstream. So when a person eats, blood glucose levels start to rise. High blood glucose levels stimulate cells in the pancreas to release the hormone insulin. And insulin serves as a key to open the door, to unlock the cell, to let glucose enter the cells. Liver and muscle cells store this glucose as glycogen. If you recall, glycogen is the storage form of glucose in mammals, and we're mammals. Once those stores are filled, extra glucose will be stored in the adipose cells as fat. Later, when blood glucose levels drop below a certain level, again, the pancreas is signaled to release a hormone. In this case, the hormone is glucagon. Glucagon is the key that tells the liver to break down stored glycogen into glucose and release it into the bloodstream to help raise blood glucose levels back to within normal range. In this case, when blood glucose is low, glucagon is being released. When blood sugars are high, insulin is being released. Normal blood glucose ranges between 70 and 110 milligrams per deciliter. When blood glucose rises above 110, a signal is sent to the pancreas to produce insulin to bring sugars back down to normal. When blood sugars go below 70, a signal is sent to the pancreas to release glucagon to help raise blood sugars back into the normal range. Hypoglycemia is another name for low blood sugar. Hypo means less than or lower than. GLYC, glucose, EMIA, in the blood. Hypoglycemia, low blood sugars. There are different types of hypoglycemia. There's what's called reactive hypoglycemia, when blood sugar levels drop quickly after eating sugar. And we'll talk a little more about this when we talk about the glycemic index. But what happens is in certain sensitive individuals, when they eat sugar or foods that have a high glycemic index, it results in a rapid insulin response or hyperinsulinemia. Spontaneous hypoglycemia is another type of low blood sugar. This occurs when the liver stores of glycogen are depleted and the ability to maintain blood glucose is diminished. This happens actually to everybody in between meals or when food hasn't been consumed. We're not eating, our glucose is dropping, and we get hungry. In the morning, the break fast or breakfast helps raise blood sugar levels. There's also what's called drug-induced hypoglycemia, and this often happens in diabetics who take their insulin but forget to eat. It's an improper insulin or oral hypoglycemic drug response. You take your medication, but then the phone rings, you have to run out the door, and you forget to eat. This is a drug-induced hypoglycemic reaction. Years before type 2 diabetes is diagnosed, there are certain conditions that begin to develop, and one of these conditions is called insulin resistance. Normally, insulin binds to receptors on the cell membrane and allows glucose to pass into the cells. But under certain conditions, this can be obesity or a genetic predisposition. What happens is that the membranes develop a reduced sensitivity to insulin. The glucose is not able to get into the cell with what used to be considered normal amounts of insulin production. So more insulin needs to be produced in order to transport glucose into the cells. With insulin resistance, cell membranes resist the effects of insulin. The pancreas works overtime to make more insulin, and eventually insulin production slows down and blood glucose levels start to rise. In other words, you can have normal blood sugar levels for years while your body is producing extra insulin. We'll talk about this in class. I think this is an important concept for you to understand. You can have normal blood sugar levels and still have insulin resistance. This overproduction of insulin results in a number of metabolic abnormalities. The one that we're going to talk about is metabolic syndrome, which is also known as Syndrome X. These are a group of metabolic abnormalities that increase risk of heart disease and type 2 diabetes. This is a list of the symptoms that lead to metabolic syndrome. What you need to understand is that metabolic syndrome will be diagnosed if the person has 3 or more of these symptoms. So in other words, you may have a random blood pressure of greater than 130/85. You may have a fasting blood glucose of more than 110, but it is not until you have consistently been shown to have 3 or more of these symptoms that you'll be diagnosed with metabolic syndrome. And what this means is that you are at much higher risk of developing type 2 diabetes. Metabolic syndrome doesn't mean you are going to get type 2 diabetes, but that you are at increased risk for developing it. And so it is very important to manage the symptoms. Lose weight if you are obese. Increase your physical activity. For many individuals, physical activity is like insulin, and it makes the cells more sensitive to whatever insulin the body is producing. Quit smoking. Replacement of saturated fats in the diet with monounsaturated fats in some studies suggests help reduce risk, and consumption of high fiber and low glycemic index foods can help control symptoms.